Good morning. Today I have a patient before me, Mrs. Swarnalata, 73 years old. Her husband is also here, Mr. Ramachandar. She underwent PRP injection into her left knee
leg.
in 2019. So it is how many years? Four years.
More than 4 years.
More than 4 years after she underwent the PRP treatment to her left knee for osteoarthritis of the knee, and then she had a booster dose in 2020. She is doing extremely well, and she has avoided a knee replacement on the left side. Although her husband, who is here, he came and said, "What, sir? Why are you delaying things? Why didn't you do a knee replacement? You said or not?"
Exactly.
And then I convinced him. I had to convince him that this treatment is good. So why do you want to go for a knee replacement? And now they are finding the benefit,
Yes.
long-term benefit.
Yes.
Because she also had a knee replacement on the right side, and she had an accident into her right knee about 1 month back, and I am treating her now. So we will first talk about the PRP treatment to the left side here in this video, and discuss the merits, the quality of pain relief, and then in the subsequent video we'll discuss about her right knee replacement and how she is doing and what risks or problems are likely to arise. Yes, Mr. Ramachandran.
Yes.
Good day to you.
Good
How
morning.
are you?
Good morning, sir. I'm fine.
You
my wife.
introduce yourself. You are Mr.
I'm
Ramachandran.
Ramachandra.
Where is
retired
what's
businessman.
one retired businessman?
I'm residing near Alvarpet. And this is my wife. I got married 50 years back.
Very good.
1971.
Okay.
She had some knee problem for so many years. But fortunately, we went to 1 or 2 doctors. We were not satisfied. When we have been suggested Mr. Venkatachalam by my friend, who already he has attended for surgery and all that, they are very happy. Now they are living in Andhra. I got a contact with them. They told, I am sitting on the floor with the help of that doctor, and I am very happy now. They were sitting on the Sai Baba temple. They showed me a video call. Then they suggested very strictly to go to sir. Luckily I came to him, and he suggested on the day one, I asked him to attend for both the legs to go for a knee replacement. He strictly told, right leg we can go for it, left leg is not necessary. You please believe me, let me try with the PRP. Then I told it may be giving trouble. No, let us try, he said. He has attended that application with the PRP, and she was happy for more than 1 year. When there was little pain, he gave a booster. Now after 4 years, even today, she is able to walk well, and she is not having not a lot of minimum pain also in the left leg. So far as right leg,
We will come to the right leg.
Yes.
So you are happy with the left leg.
Yes.
And have you brought the X-ray by any chance?
Yes.
No. You brought the X-ray, no?
Yes.
You brought the X-ray.
Yes.
Let's see the X-ray. So these are our X-rays. The one on this side, as you can see, is dated 13 February 2020. You can see on the right side I have done the knee replacement. On the left side the joint space was narrowed. So this was grade 2 of osteoarthritis. This is the recent X-ray when she came after an injury 1 month back, which is 15th November 23. Even after a domestic fall at home, the right knee, we will discuss that separately, seems to be intact. There is no loosening. There is no radiolucent line beneath the prosthesis and the bone. And this is the left knee. The condition is actually better on this side. Most importantly, the joint space narrowing has not worsened. It has maintained. And on the outer side of the knee, the joint space is well preserved. So the result is that with PRP treatment, PRP and SVF treatment leads to stabilization of the osteoarthritic process, and worsening is prevented. So as in her case, the result has lasted for 4 years or 4.5 years.
Yes.
Now.
More than 4.5 years.
More than 4.5 years. So,
Is it 12? 4 years and 10 months.
because it was done in
Yes.
2019.
Yeah.
4019.
19.
So the result is for more than 4.5 years.
Yeah.
Almost 5 years now.
Yeah.
10 months, 2 months
10
short of 4 years.
And there is no complaint at all now.
There is no complaint
Not
at all.
even minimum.
So, so in suitable cases, even in moderately advanced cases, we can do this PRP. And if the damage is more severe, we can do the stem cell or stromal vascular fraction treatment.
Oh.
Do you agree with that?
Yeah.
PRP treatment is good or not?
Yes, good.
Good.
It is good for our concern. Our reporter can say she is perfectly all right.
So I'm happy, madam. அன்னைக்கு வந்து எப்படி கஷ்டமோட வந்தீங்க, இன்னைக்கு வந்து நல்லா நடந்து வரீங்க. இன்னைக்கு நல்லா இருக்கீங்களா நீங்க?
நல்லா இருக்கேன்.
உங்களுக்கு எந்த பிரச்சனையும் இல்லை. ஸோ இப்போ வந்து உங்களை நடக்கிறது அந்த வெளியில போயிட்டு நடந்து வாங்க எப்படி இருக்குன்ட்டு பார்ப்போம். இப்போ
I want to tell one more thing.
சொல்லுங்க உங்க.
So far as PRP is concerned, first I was not fully happy and I suggested for knee replacement both the legs. He only insisted make a trial for PRP for the left leg and he assured the result. When we came with pain, after administrating the PRP, immediately there is pain has gone and she was able to walk very well. I felt it was a miracle and I thought it would be very few minutes. But it lasts long for more than 1 year. When there was little pain, he gave a booster. From that onwards, it is more than 4 years and 10 months. There is no complaint at all, not even that minimum pain.
And you've seen the X-rays improved.
Yes. Yeah, exactly. Had we have had the PRP earlier stage on the right leg also would have been happy because that knee replacement afterwards exercise and everything was a little bit risky.
And if one has a fall, it leads to a lot of worry.
Yeah.
Right now. Right
Had
now.
we have earlier connection with the right leg also would have been gone for PRP. So it's all right having gone.
ஓகே. ஸோ உங்களுக்கு ரைட் நீ வந்து 2019 பிப்ரவரியில் பண்ணித்தா?
மார்ச் 1st.
மார்ச் 1st. மார்ச் 4th 2019. இப்போ வந்து 4.5 years 4 years 10 months ஆகுது. ரைட் நீ நல்லா இருக்கா? இந்த கீழே அடிப்படுற வரைக்கும்
நல்லா இருக்கு.
எந்த பிரச்சனையும் இருந்திருக்கா அந்த 4 வருஷத்துல? உங்களால என்னெல்லாம் பண்ண முடியுது? தள்ள கீழே உட்கார முடியுதா?
கீழே உட்காந்து எழுந்திக்கிறேன். ஆனா grip இல்லாத முடியாது. grip வச்சுன்னு
கீழே உட்கார முடியுதா?
So she can sit on the floor.
She can sit on the floor for any longer time. And as the other women friend suggested, she was sitting on the floor for hours together on Sai Baba temple. But my wife is sitting more than 1 hour, something like that. Not requirement also. And she is going for that exercise and all that very regularly. That PRP would have done, exercise also need not be done. It's all right. அந்த நீ ரீப்ளேஸ்மெண்ட் தான் எக்ஸசைஸ் எல்லாம் பண்ண வேண்டியது.
கரெக்ட். இப்போ நீ ரீப்ளேஸ்மெண்ட் பண்ணலைன்னா எக்ஸசைஸ்லாம் வெளில தேவையில்லை. இல்லை. அதனால வந்து லைஃப் வந்து சின்னது. எவ்வளோ டைம் தான் வேஸ்ட் பண்ணிட்டு இருக்க முடியும்? 3 மாதம் வந்துக்கும் எக்ஸசைஸ் ஃபிசியோதெரப்பி அனுப்பிச்சாரு உங்களுக்கு, உங்க வீட்டுக்கு வந்தாரு. இதில் வந்து பிஆர்பியில் இம்மிடியட். ஸோ பட் தேவையான பண்ணி தான் ஆகணும் ரீப்ளேஸ்மெண்ட். அது எல்லாருக்கும் வந்துட்டு பிஆர்பி போடுறேன் அப்படின்னா வந்து சரி வராது.
அந்த கண்டிஷன் பார்த்தா நீங்களே சொன்னீங்கல்ல, ரைட்டுக்கு பண்ணி தான் ஆகணும், லெஃப்ட்டுக்கு தேவையில்லை நீங்களே சொன்னீங்க. நான் ரெண்டுமே ஒரே ஸ்டேஜில் பண்ணலான்னு தான் கேட்டேன்.
ஆமாம்,
நீங்கள் தான் வந்தீங்க.
ஆமாம்.
இன்ஃபேக்ட் ஐ எம் டெல்லிங் யூ வெரி ஃப்ராங்க்லி, the other doctor we went before coming here, he suggested knee replacement immediately for both the legs. We don't want to give even a 1 week time. Then only we came here. Luckily my friend has suggested him.
And now today
I am suggesting a lot of people to
today who has come, another gentleman has come
just a few minutes back. A devotee in Parsadi temple.
Parsadi temple.
Friend of, yes. He's a regular devotee of Parsadi temple. Every day he visits, and his wife is having some problem. And I suggested he came here. You have to follow.
She's gone for X-ray now.
After getting the X-ray, he will do whatever is best.
And they have got great hope because of her result.
Yeah, exactly.
Oh, thank you.
It's a proof we are having.
Thank you, madam. நல்லா இருங்க. இந்தாங்க X-ray. இப்போ நடந்து காட்டுங்க கொஞ்சம், ஒரே நிமிஷம். வலது காலில் வந்து ரைட் நீ ரீப்ளேஸ்மெண்ட் பண்ணியிருக்கேன். ஆமாம் சார், இல்லை மேடம்?
ஆமாம்.
இப்போ லெஃப்ட் நீயில் வந்து இந்த வலது கால் அடிபட்டுது. இப்போ வந்து அன்னைக்கு வந்து நடக்க முடியாமல் வந்தீங்க. இன்னைக்கு டுடே யூஆர் வாக்கிங் இல்லையா?
ஆமாங்க.
ஓகே. இன்னைக்கு பெயின் ரிலீஃப் இருக்கா? இப்போ இன்னைக்கு பெயின் இருக்கா ரைட் நீல?
இல்லை இல்லை,
ஒன்றும் இல்லை.
ஒன்றும் இல்லை.
யூ ஹேவ் எனி பெயின் இன் த ரைட் நீ?
இல்லை.
நோ பெயின். வெரி குட், வெரி குட். ரைட், தேங்க்யூ.